Hello, viewers. Today I want to talk about American health insurance system. This year, the health insurance premiums have gone up tremendously. My family and I, we were paying around $1,450 per month, and now suddenly they jacked up to around $1,750, so almost $300 jump. And on top of that, the deductible or out-of-pocket costs have gone up from around $14,000 to $21,000. So basically, your out-of-pocket cost has increased tremendously, while your premiums cost also has gone up. Now, this is a really big problem. The other good thing after Trump administration is that individual mandate is already dead. So there's no more individual mandate. Do you remember that Obama actually mandated through federal government laws that you have to have health insurance, otherwise IRS will penalize you. And so that mandate is already dead. So thank God for that. And thank you, Trump, for doing it. So basically, now you're paying, a bunch of money to these health insurance executives. And in the end, when you need health coverage, you still have to pay a whole lot of money out of pocket. So basically, I think this system is extremely rigged, and one of the way to kill it is to basically not enroll, not have health insurance, and just encourage cash pay or pay as you go. Basically, I encourage that whenever you need to use health coverage, you can negotiate price with healthcare entities like clinics or hospitals, and you can negotiate a price, and a lot of time they're willing to do that. So this way, at least you're paying what you're using, the amount or the services that you have used. So your money is not going into pockets of some healthcare executives and all that. The other thing I think we should all try to force Congress and lawmakers is to allow health saving accounts without having to have high deductibility plans. You have to have high deductibility plans in order to save money in health saving account, which is pre-tax money. So basically, if Congress allows certain amount which can be saved every year pre-tax, and people can use it towards healthcare costs, just like HSA. So HSA, without needing for a high deductibility plan, if there's a IRS has this exemption, then we don't even need health insurances, because everybody can deposit money, save money in health saving accounts, and this way they can easily use that towards their health expenses. So please note that this video is only for educational purpose, and I don't make any recommendations. You are going to make choices based on your own decision and information. Please do your own research. What I'm going to do is I will not have health insurance. In fact, I did not have insurance for a few years in the past also. And instead, I just paid whenever I needed to go to hospital or clinics. I was just paying cash. So I think this is the best if we all consumers force the system to go back onto cash payment. And secondly, the other thing we can force regulators to mandate healthcare entities to list their prices. We need to ask all the state and federal regulator authorities to mandate healthcare entities to list their services price. Just like when you go to Target or Walmart, you can see those prices. So why we can't see prices before going to hospital, like what it costs to treat pneumonia or hip fracture or infection of skin? So they need to list their prices. We need to, price ambiguity is the biggest way this racket is going on. So insurances, they want price ambiguity. This is what you need to understand. Once healthcare entities or hospitals or clinics, they are forced to list their prices, everything is going to be clear. This is what market requires. Price clarity, so consumers can make the best decisions. So anyway, I wanted to discuss about this because I see that there's not much information on the internet, and I hope you guys get educated yourself, and we can all make this better.